All right, it is Tuesday morning. We are in the KPVI gym. We're with our good friend Karen Donaldson of Excel Weight Loss, and we are talking about some not just good ideas. These are some things that people need to be doing in order to, maintain some good health, just get in shape. And these are things that I hadn't even thought about. Tests that need to be done.
Yes.
We've talked about cholesterol
Right.
on the show before, getting
Right.
the cholesterol test done. But you say there's some other tests that people should be thinking about.
There are some. We're having health fair coming up on Thursday, April 28th. And you asked earlier, what do you have to do to get these tests done? And it's really a simple blood draw. So it's nothing that's too complicated. They're just going to draw some blood anyway to collect and test for your cholesterol. So one of them is the PSA, prostate-specific antigen, and that's for men only.
Okay. How old are you? How old do you need to start thinking about this?
Well, the guidelines differ. Some societies recommend that you start at age 40 for men. Some say age 50. So somewhere in there, depends on your family history, your risk factors, and so on. But somewhere in that range, good idea to get a baseline on the PSA level. That's not the only test that detects prostate cancer, but it's a good start, and it's a very easy screening test.
Yeah, if you're going to get the blood drawn, it's a great way. You were talking about vitamin D deficiency, and you brought some eggs with you this morning, and I hadn't thought about egg yolk.
Yeah, very few foods naturally contain vitamin D. So very often we have to supplement with vitamin D, and people in our area especially tend to be low in vitamin D levels. And it's been linked to everything from diabetes to depression to immune function, bone health, of course. Vitamin D, very, very important nutrient. A lot of people are low, and that's another one that you can detect with a blood test.
And that's one of those ones that if you're out in the sun, you should be getting it, but also a good idea to do some supplements also.
Usually it is a good idea. Even being out in the sun around here doesn't seem to be enough for a lot of people. So a good idea to get tested and find out if you're low. I would say about 90% of the people who come through our health fair and get their vitamin D tested are low and need some supplementation.
And you're saying egg yolk, hard-boiled, fried, any way.
And salmon, too, if you don't like eggs.
All right,
Yeah.
salmon's another good option. Really quickly, details of that health fair one more time, April 28th.
Thursday, April 28th, 6:30 to 9:30 a.m. by appointment, so you don't have to wait in line. Call us at 233-0593.
All right, Karen, very good advice. A lot of things going on that people need to be thinking about, especially as the weather starts to change and people want to get out and enjoy some of this weather, making sure you have some good health.
That's right.
Brandy, we'll send it back